Malignant mesothelioma is an aggressive asbestos-related cancer which involves the lining of the lung and the chest wall along what we call the pleura. It affects about 10,000 people a year worldwide, and the incidence has been increasing despite the decreased use of asbestos. Without treatment, patients usually survive only 4 to 12 months, but with new surgical innovations such as we're going to show you today, in combination with chemotherapy and radiation therapy, we have begun to improve survival in a subset of patients. Malignant pleural mesothelioma affects about 2,000 to 3,000 new cases per year in the United States. It is a malignancy of the parietal and visceral pleura, and it can extend into the lung as well as the fissures in the parenchyma of the lung as it grows. There is an increasing incidence of this disease despite the decreased use of asbestos, and there has been controversy about the role of simian virus 40 as a co-carcinogen.
Our patient today is a 78-year-old gentleman who presented with approximately 3 to 4 month history of shortness of breath and dyspnea on exertion. His workup demonstrated a left pleural effusion. We can see the left-sided pleural effusion, which is the opacity located generally posteriorly. And of note here is the pleural thickening, which extends anteriorly and circumferentially around the hemithorax. It's very irregular in that area, and we can see a clear abnormality. On the next views, we see that the effusion is larger and has circumferentially compressed the left lower lobe, leading to dyspnea. Also, interestingly, on this pattern is the speckled appearance seen in both hemithoraces, which is also seen here, and represents calcification or pleural plaques, which is due to asbestos-related disease. The chest MR scan, which was obtained after that thoracoscopy. Here again, you can see the circumferential highlighting of the tumor, which extends most prominently inferiorly within the hemithorax, where the bulk of the disease is. This is a sagittal view or a sideways view, and we can see the enhancement of the tumor circumferentially and also the tumor involving the fissural surface between the lobes of the lung. We can see the tumor lying on the diaphragm but not extending through the diaphragm into the abdominal contents. We also use the cross-sectional views seen here to identify whether there's invasion of the tumor into the great vessels or into the heart inferiorly.